I'm Molly Kimball. Welcome to Fueled, a wellness and nutrition podcast. I'm a registered dietitian and nutrition journalist with a passion to help people live their strongest, healthiest life possible. In my weekly TV segments and columns, there's a limited amount of time and space to cover everything, but there's so much more to share. This podcast is my opportunity to dive deeper into the topics you want to know about. Today's podcast is all about nutrition and our skin and how we can fuel our bodies to maximize that vibrant, glowing skin, to slow down and minimize the signs of aging, and what we can do nutritionally to help with issues like acne, psoriasis, rosacea, and even skin cancer. I had the opportunity to sit down with two leading dermatologists to examine the links between diet and skin to help us make sense of the latest research, clarifying what's legitimate science and what's just marketing hype, plus give us the tools to empower us to look and feel our best. So diet historically has been dismissed as a significant contributor to the way our skin looks and feels, but more and more research is showing us that what we eat really does have a significant impact on our skin's health and appearance. So in this week's podcast, we'll cover just how our diet and our weight influences our skin, what we should eat and what we should avoid, and specific supplements with solid science showing the benefit. So without further ado, let's dive right in. I'm super excited to be sitting down with Drs. Mary Lupo and Julie Mermiliod. Dr. Mermiliod is a board-certified dermatologist since 2000, and she's the system chair of Ochsner Health System's Department of Dermatology here in New Orleans. She's also the clinical associate professor of dermatology at LSU Medical School, Tulane Medical School, and the University of Queensland-Ochsner. Dr. Lupo is a board-certified dermatologist since 1984. She has her own practice also here in New Orleans, the Lupo Center for Aesthetics and Gen Dermatology. She's a clinical professor of dermatology at Tulane University School of Medicine, and she's the founding co-director of the Cosmetic Bootcamp, a continuing education conference for physicians practicing in the field of aesthetics. So welcome, you guys. I'm so excited for y'all to be here. As your intro say, there's so much that y'all do. I had no idea that both of you do so much in addition to just seeing patients. So thank you. Welcome. And Dr. Lupo, I have to say, I recently saw on your Instagram a super cute post. It was a photo of you back to back with another physician.
So I was speaking at the Foundation for Facial Aesthetic Surgery, and they had a really fun session. It was me facing off with a facial plastic surgeon, and they presented us cases and asked us, what would I do non-surgically and what would he do surgically? And it was sort of a point, counterpoint, different viewpoints. It was amazing how much we agreed. Because sometimes people wait so long that they're beyond what non-surgical techniques can do, and they have to have surgery. But it was a lot of fun. And yes, the Lupo Dermatology Instagram, that got a lot of likes.
Right. It was very cute. They were like back to back, and they kind of both had like their like guns
like
up.
Hamilton and Burr.
Yes.
Except this time no one died.
And so kind of diving in, when it comes to nutrition and skin, is this a topic that y'all get asked about a lot? Is it something that patients are asking about? What should I eat for XYZ skin concern? Or is it something that's not really on their radar?
In general, for me, I would say they don't proactively ask. I actually bring it up in a lot of cases when I think the nutritional aspect of their health might be relevant to their condition, whatever that condition is. And I do tend to always treat patients in a global capacity. And by that, I mean, I try to do as little as possible with medicine and try to do as much as I can that empowers the patient. And of course, as a dermatologist, my number one recommendation is to use a sunscreen every day. But I do feel very strongly that nutrition in general is very important to health. And very rarely does a healthy person not look good. And conversely, a person who is not healthy usually doesn't aesthetically look good. So there's an important component of good nutrition to the aesthetic appearance of a person. And so we do talk about it. And I also talk about it with certain inflammatory skin conditions where inflammation is the driving force. I try to explain to my patients that if you can take probably every disease and you could categorize it into one of three gigantic categories. One is infectious, and that means it's caused by some organism or some infected state. Two would be neoplastic, and that's any condition where there's overgrowth of tissue. It could be benign, but it could be malignant, but it's from neoplasia, new growth of an abnormal amount. And the third, and by far the biggest category in all of medicine, is inflammatory. And it includes everything from heart disease to eczema, rosacea, acne, and also it does involve aging. Aging, in my opinion, is a chronic, relapsing skin condition, and you have to deal with it every day. And what I try to do is empower my patients that they feel that they're partnering with me to look better. If it's all on me, I feel like I can't really do as much as if they're on board and they're doing the topical regimen that I give them, that they're, eating better, sleeping better, managing their stress better. Because I think you need to do that before you start lasering and injecting, because you'll get better results when you treat it globally. And more importantly, a lot of my patients are women, and it is personally very important to me that women feel empowered and women feel like they have control over their lives. And I think that one of the things that causes depression is when people feel that they've lost control over a situation. They feel powerless and there's nothing they can do, and they feel hopeless. And I've seen, unfortunately, physicians in the aesthetic field who actually prey on women who come in who are already vulnerable, and they actually make women feel worse about themselves. And so I like to make people, even if you're coming in and your face is a train wreck because you're 60 years old and you've never used sunscreen and you're a golfer and your weight has fluctuated, and I still don't want to beat you up. I want to tell you what I can do to make you look better and give you the tools moving forward. And then I usually tell her, do you have a 35-year-old daughter? Because that's who you really want to send to me, because, a stick in time saves nine. I can keep her away from the plastic surgeon if she comes and sees me soon enough.
I love this. I love this approach. Feeling empowered, feeling like we have that sense of control, and that really what we do matters and can really impact our health, our skin, and the way we look and feel. I think that's just a fantastic way for patients to feel when they leave your offices. So what are the things, some of the kind of when you decide that you're going to bring up nutrition as part of the, hey, what's your diet like? What are you doing? What are some of the things that would be a catalyst to ask that question? What are some of the things that you're seeing? I know for me as a dietitian, when I see someone, they have dark circles under their eyes. They have, that's a telltale sign for me, alcohol or sugar, and so I can see from their eyes, from their skin, breakouts, adult acne, they may be a healthy weight if they're coming in. And sometimes they're coming in for nutrition and they, at the prodding of someone else, and they don't think they need it. And I can take one look at their skin and their face and their eyes, and I know they need it.
No, I actually proactively say something like, this condition, let's say it's acne or rosacea, is an inflammatory skin condition. It tends to be chronic, and there is pretty good data that says that a high glycemic diet exacerbates acne, rosacea, and potentially other inflammatory skin diseases. So I will suggest proactively that they cut down on sugars and that they eliminate or significantly reduce what I call gratuitous calories. And what I mean by that is, if somebody loves ice cream, I kind of sort of go, well, they're getting some calcium from it. There is no nutritional benefit to a cookie or a donut or a piece of cake. It tastes good, but I cannot think of a justification. There's also no reason, in my opinion, to drink a soft drink. People need to drink more water, and they need to drink, and even diet drinks, in my opinion, are not good for your skin because I think it has an effect on the kidney and the kidney metabolism. So, it's a holistic approach. People need to I tell people I'm a physician, I'm not a magician, and you need to take ownership of your health and the care of your skin.
I like it. Okay.
Yes. And I actually completely agree with Mary. Most patients don't come in asking me what they can do differently for their diet because most people don't want to change their diet. They like all the junk food and the high fatty foods, but sometimes they do. And it's particularly people with acne, especially the moms will ask on behalf of their teenager, is it the chocolate or is it the soft drinks? And, the older data would have said, no, it's none of that. In fact, when I came out of residency, we would say, no, it's none of that. But more recent studies have really shown that those foods, not chocolate specifically or soft drinks, Coke specifically, but everything in that genre, everything that's high, like Mary mentioned, have a high glycemic load, which is both how much sugar is in it and how quickly it's absorbed into your body, which is the glycemic index. They're very pro-inflammatory and they absolutely exacerbate acne and other inflammatory diseases.
In fact, if someone really has a sweet tooth, I encourage them to satisfy it with dark chocolate because the flavonoids that are in dark chocolate are beneficial. The problem with chocolate is the sugar. So the higher the percentage of cocoa, the lower the percentage of sugar, the better it is for you. So you kind of have to retrain your palate to appreciate dark chocolate. So maybe start out with like a 55% and then gradually, because it is not as sweet, it is a little bit bitter, but you can get an acquired taste for it. It's like scotch. You can get an acquired taste for these things. You have to retrain your palate. And I promise people, if they would just get rid of sugar in their coffee and their tea and whatever, just if you're used to putting in a couple of teaspoons, cut it to one. And then gradually, I completely eliminated added sugar to my diet at probably about 18 years ago. And I got to tell you, I now don't even like sugar in my tea or in my coffee. I like it without it. You can retrain your brain and you just got to be patient and go along with it. But people need to understand that there's a lot of sugar in things that you have no control over.
I love this. Y'all are preaching to the choir. I'm over here. I'm like, amen. So for a quick recap for our listeners, sugar, it's among the worst things nutritionally that we can put in our bodies. If you didn't know it already, you're hearing another reason to cut back on sugar. If we feel like we're addicted to carbs or addicted to sugar, we truly can retrain our brains, retrain our taste buds, and we can really start to curb those cravings long term, not just a quick fix. And if we're craving sweets, try to satisfy it with dark chocolate. And as Dr. Lupo mentioned, the darker, the better. Look for at least 70% cocoa or higher. It'll say it on the label. If it doesn't list the percent, it's probably just in the 50s or lower. Even if it says dark chocolate, it can still say dark chocolate and only be about 50% cocoa. If it says, if it's actually 70% or higher, they're going to be proud of it. They're going to have that smack on the front of the label. The higher the percent of cocoa, like 70% or more, means less sugar, more antioxidants. Okay, so let's talk nutrition and aging. Give us the rundown, the fundamentals of collagen, elastin, glycation, inflammation, all these things that tie in with how our skin looks, how our skin ages, and really how what we eat, and sugar specifically, can immediately impact our signs of aging.
So the skin ages because of a multitude of factors. A lot of how your skin ages is genetically determined. The old saying that a guy should look at his fiance's mother to get an idea of how, there's some truth to that. You inherit your aging patterns, if you will. So part of it is genetics, and this probably has to do with telomeres and, the length, and how your body recovers from inflammation and all kinds of things that is so complex and so unique to every individual.
And things that we can't control.
And that you cannot control. So what can you control? Well, you have to use sunscreens every day. And in addition to sunscreens, topical antioxidants are extremely beneficial. But in addition to that, there are nutraceuticals that have anti-aging study and data behind them. So for example, you want to, there's that Polypodium leucodoma.
Heliocare.
Yeah, the Heliocare. Heliocare, the Ultra is the highest form. Now, the history behind that is very interesting because it was originally recommended and used for people with a rare sort of autoimmune UV-induced rash called polymorphous light eruption.
And Heliocare is a supplement.
It's a supplement. And PMLE is basically you're sort of allergic to UVA light. And this was found to really mitigate it, probably through some mechanism of the inflammatory response that the patient was having. And then subsequent to that, we found that, it kind of helped other UV-induced conditions like melasma, which is aggravated by ultraviolet light. So that probably has some anti-aging benefits too. In addition, niacinamide has been found in Australian studies to have a photoprotective effect for non-melanoma skin cancers, basal cell carcinoma, squamous cell carcinoma. So that's a B3 derivative. So that's very, very interesting. There's some studies that have shown that vitamin C's and vitamin E orally can help mitigate some of the erythema from sunburns. Now, whether that translates into mitigating this damage to the collagen and elastic, I don't think that's been shown. But as far as the redness goes.
Okay, so to clarify for our listeners, when we're looking at supplements, Heliocare is an oral supplement that is skin protective, sun protective, and the Heliocare Advanced actually has the niacinamide in it, the dosage of B3 niacinamide that's recommended. So if you're taking just B3, 500 milligrams twice a day, or an oral supplement like the Heliocare Advanced, which can be ordered on even Amazon, taking the Heliocare Advanced has the niacinamide. For vitamin C, we typically recommend 1,000 milligrams once or twice a day. And then for vitamin E, about 400 units daily.
And then there are these amino acid supplements that are the building blocks of the protein of your skin, which is collagen and elastin. So the skin kind of has three food groups in there. There's protein in the form of the collagen and the elastin. And then there's the sugars, which is your polysaccharides, which is mainly your hyaluronic acid, which gives skin some of its moisture retention capabilities. And then there's the lipids of the skin, which give lipids help your skin hold on to water better. So I jokingly say, your skin has protein, it has sugar, and carbs, and it's got fats. And incidentally, one of the other things that I sort of anecdotally tell my patients is, and this is to all of the young people out there, in my opinion, you want to be at your ideal weight when you're 40 years old, because to have a significant weight loss or weight gain over 40 ages you tremendously.
You notice that a
Yes.
lot. And you don't, yes, you can tell they needed to lose a lot of this extra weight.
But then they
perhaps.
get haggard because what happens when you lose weight when you're older is it affects the fat pads of your face and they no longer can hold your face up. So you sag and you start looking gaunt.
I've had several clients, lots of clients actually tell me that they've had to make the choice between their ass or their face.
I've heard that, but they don't because we have good fillers. We have good fillers that will volumize the face like the fat. The problem is that you have to maintain it because, in my opinion, you always want to use either a totally biodegradable filler or one that is gone in a couple of years. You never want to put a permanent filler in your face. That's an absolute, in my opinion.
So let's back up, and can y'all kind of give for the listeners a rundown of, I think we hear a lot about collagen, elastin, and when we talk about like why sugars are so bad for that, and like the cross fiber. So
well, collagen and elastin are the structure of the skin. Basically, it's what gives the skin its form. And in between the collagen and the elastin is what's called the ground substance. And this includes glucosamine and glycosaminoglycans, hyaluronic acid, these polysaccharides that support these little strands, which is what the collagen is. And then what we see on a biopsy with the usual stains of the biopsy is this is what you want your skin to look like on a biopsy. You want that collagen and elastic tissue. First of all, it's very hard to see elastic tissue on a regular biopsy. It requires special staining. And elastic tissue becomes problematic when it gets sort of frayed and stretched, and that means that the skin won't spring back. So the collagen kind of gives it its firmness, and elastin gives it its flexibility. And so the collagen looks very pink. But the other thing that's extremely important is something called the dermal epidermal junction, which is where the epidermis meets the dermis. And the reason that that's so important is you really want it to have a certain structure, and you want to have what are called these reedy pegs. The DE junction is the spine of the skin.
And can you explain what the dermal and the epidermal parts are for someone?
Epidermis is the top layer of skin. Basically, most of the epidermis is non-living cells. There's no more nucleus in it.
That's what we see.
And that's what you see. That's where your pigment is, unless the pigment has been disrupted from the dermis, from the epidermis and the dermal epidermal junction, and it's fallen into the dermis, which is a very bad thing because dermal pigmentation is darker. It has a bluer color to it, but more importantly, it's very impervious to topical bleaching and brightening agents. It's very difficult to get rid of dermal pigmentation. And so the epidermis is where your skin color is. If you sort of fillet off the epidermis, you often have a hard time telling the race of a patient because the dermis kind of looks the same. There's pigment in the dermis, but by and large, the epidermis is the color. That's where the brown spots are when you don't watch the sun and all this other stuff. The dermis is where the blood vessels are. The dermis is where a lot of your immune systems live until they move to the epidermis. And so one of the things that is important about ultraviolet light exposure, especially UVA, is it completely paralyzes the T cells of your skin called the Langerhans cells. And that's why people, when they get sun, it will trigger their fever blisters because the fever blister virus is always there. It just, your immune system gets weakened from the UVA light and it triggers.
Yep. And your UVA goes much deeper than your UVB. So it's your UVA that causes or is responsible for a lot of the aging that we see because it destroys those collagen fibers and those elastic fibers that Dr. Lupo was talking about.
Okay, wow. So that's so much to think about. And when you guys are looking at our skin, y'all are seeing so much more than what we see when we look in the mirror. So to summarize, collagen gives our skin its firmness. Elastin gives our skin that flexibility. And clearly, none of us want our epidermis to collapse because very bad things happen. So, okay, so when we're talking about sugar and the inflammatory effects, how do these factors, how does this specifically disrupt these collagen fibers? So we hear that it does, but how does sugar and inflammation really disrupt this collagen? And cross-linking, we hear the term cross-linking, or you read about it when you're talking about skin and aging, but what does this really mean for our skin?
It means that there's a bridge between the fibers
that shouldn't be there.
And that changes the function and the behavior of the collagen and literally ages it. That's why advanced glycation end products is AGE, which is age. So you don't want these glycation products there because it causes cross-linking of the collagen fibers.
So, and these advanced glycation end products are caused by high sugar,
Yes.
high glycemic diet.
Yes.
So if you've got no other reason to cut sugar out of your diet, it causes these basically misformations in our collagen that immediately is resulting
Absolutely.
in wrinkles.
Now, remember, the overriding number one thing that messes up your collagen is sun. Okay. So, this is about nutrition, but the people who are caring about nutrition from the aspect of an aging process need to make sure that they're using sunscreen every day.
Yeah, right. And one of the things we haven't talked about actually is the free radicals also. That is formed from the UV damage, but also the environmental factors, smoking, the foods that we eat, all that causes free radicals. And when those free radicals, they chew up our collagen, chew up our elastic tissue. So I have a lot of patients that come to me for what we would call skin checks. They might not have ever had anything necessarily wrong with their skin. They might not have ever had a atypical mole removed or a funny looking mole removed or ever had a skin cancer, but they want to make sure that their skin's okay. So we get them disrobed and we start the examination. I can tell a golfer and a tennis player from across the room. The way the numbers of the brown spots and where they're located totally gives it away. So as I'm starting on their arm and working up, I say, so how often do you play tennis? And then right then and there, they'll say, oh, well, I usually try to play 3 times a week. So it kind of opens up the discussion for sun. And I usually tell people, listen, you don't have to stop doing what you love, although I'd love you to start playing racquetball instead. But it's super important that you change or modify the way you do it. Maybe when you were 15 wearing your sun shirt to play tennis, you might have been ostracized. But you're 38 now. If we're still worried about what people think about us, we have bigger fish to fry. And so I tell them, wear a sun shirt. They make such great sun protective clothing now. Not the big baggy Fisher shirts only. I mean, you can get some really fitted stuff that you wouldn't even know is SPF impregnated.
I love that. And then so my husband comes to see you for his mole checks and skincare and everything. And he is a tennis player and he grew up
with
outside,
very blue eyes
and very spotty shoulders.
Very spotty shoulders.
And I think, didn't he say that's just how it was?
Yeah. So many people think that they're one of the most common things I hear from your husband, I heard it, but I also hear it from lots of people, especially people with red hair who have freckles, is I was born with these. And I always say, you actually weren't. Well, I've had them my whole life. And I'm like, well, you actually didn't because you weren't born with them. You got them from sun exposures. Freckles and freckling is a sign of sun damage, just like wrinkles are. And I usually tell people, well, look at your butt. Your butt doesn't have freckles. And that always usually gets a pretty good giggle.
It's true. And they remember
Except for when their butt does have freckles. And then I talk to them about tanning bed use. One of the things is that it's super important not to put your sunscreen on in the morning and think you're protected all day. You just aren't. Nothing is that good. So I usually tell people if they're going to be in water or sweating, they need to reapply really every 1 to 2 hours. And then just regular sunscreen is really going to only have a 3 to 4 hour lifespan on your skin.
And give us a rundown on SPF.
So SPFs, in my opinion, are quite misleading. Basically, an SPF of 30 is going to block out about 98% of the damaging UV. And that's considered to be, that's what's recommended by the American Academy of Dermatology, is an SPF 30 on your face and neck every single day.
So if I'm using an SPF of 70, it's making me feel better.
Right. But the problem is that those SPFs and the numbers are based on using a certain quantity. And we are absolutely known for using about half or a quarter of the quantity that you need to get that SPF 30. So yes, you might be using a 70, but if you're only using half as much as what you need, you may only be getting, it's not exactly mathematical, but you may only be getting a 30 out of that 70.
So I lather up pretty thickly with it. So I might be doing okay with it.
You might be doing okay with it.
But for most people, if you're looking at, you're liberal with it, a 30 is going to be fine.
So they say a teaspoon is the amount that you should have to cover your face.
Wow.
And a shot glass would be the amount that you would use to cover your body.
And what about the sprays?
That is such a great question. So there's been a lot of controversy about the sprays because of the aerosolized particles and what that might be doing to our lungs. But as a skin doctor, I'll kind of stick with that. I have seen more people burn after using a spray than any other modality of sun protection. I think that most of it kind of gets lost in the air and it doesn't really go in the skin. There are some sprays that are okay, but those are the ones that you have to spray and then rub.
And we were on vacation recently, and the right down the way from us, we saw a guy spraying his sunscreen on. His what we learned later was his very new wife. They were there for a honeymoon. Had gotten herself into a raft or was trying to, and she kept falling out. I'm not going to say we were laughing, but we were like definitely watching and trying not to. And it was actually a raft shaped like a giant flamingo, and she couldn't get in there, and she was struggling, and she was calling for him for help. And his answer was he had to wait for his sunscreen to set for 30 minutes.
Hysterical.
So do you have to wait 30 minutes?
So it depends on whether you're talking about physical blockers or chemical blockers. Physical blockers are ready to go right then and there. But chemical blockers, and if he was using a spray that has chemical blockers in it, the reason you need that 20 to 30 minutes is that you need it to make the chemical reaction in your skin in order to prevent the sun damage.
Okay, so shifting gears entirely, let's talk about acne for a bit. This is such a huge issue, and not just for teens, but for adults as well.
Absolutely. So acne is one of the problems that people come in for, that they do try to blame diet and ask about diet and recommendations. And we have a handout that we give them, and it talks all about high glycemic loads and avoiding those high sugary foods, and even the whites, the starches and that sort of thing, and to try to do things that not only have high sugar content and deliver it fast. If you're going to do something sugary, you want it to be something natural.
Every time I'm reading about acne and high glycemic load, which is typical of our American diet, and the influence that it has on that, how does that impact our skin and acne?
What happens is the adrenal glands are often activated, and they produce androgens that sort of feed the sebaceous gland. And what happens is the sebaceous gland starts putting out more oil than the pilosebaceous shaft. It's like an elevator shaft with a little side door, which has the sebaceous gland. And what happens is when that sebaceous gland starts pumping more oil than the channel can handle, it gets backed up. And when it's combined with abnormal keratinization, which is the process where skin turns over, and so there's dead skin cells in that pore too, it's the perfect storm. And when there's inflammation in the body in general, there are increases, there's effects with high glycemic diets and the insulin levels. And also the body starts developing resistance to the insulin. We don't know all of the mechanisms of action, but at some point, what these things do is have a direct effect on the sebaceous gland. And I would also like to sort of mention that stress in general has a direct effect on the adrenal gland, which increases the output of cortisol, which is acnegenic, as well as the androgens, which are androgenic and sebaceous stimulating, if you will. That sebaceous gland produces too much oil for the pilosebaceous unit to contain. That oil gets clogged. It is then biodegraded by the naturally occurring bacteria in your skin to form what's called free fatty acids, which are highly inflammatory oils in your skin that cause the actual pore to rupture underneath the skin, which leads to a nodule or a cyst. And then the inflammatory response around that actually damages the collagen tissue, and that's what causes an indented scar.
Wow. What a fantastic explanation. I love this visual, and I will never, ever look at a clogged pore the same again.
When it comes to dairy and acne, I really get a history because I think that individual variability to dairy with their acne exists. And some people, the dairy is significant, and some people it isn't. You know, I'm sure you do this all the time. Food diaries can be very helpful to associate when I do this and what I see. Like I see a peak in acne in New Orleans during Mardi Gras time, and I think it's directly related to king cakes.
I have not noticed that.
Directly related to king cakes. And we didn't talk at all about alcohol, but you know, alcohol and rosacea, that's an important thing to talk about with our patients. And it's twofold. Number one, alcohol is vasodilatory, meaning it dilates your blood vessels. Well, rosacea, there's flushing, there's broken capillaries, dilated telangiectasia, capillaries, all of that stuff. So number one, the vasodilatation of alcohol is bad. But the other thing is there isn't an alcoholic drink that doesn't have a significant amount of carbs in it. And so it's the glycemic factor, again, feeding into the rosacea. So alcohol has a double whammy with rosacea, with vasodilation, flushing, and then increasing the glycemic load.
Which by increasing the glycemic load is going to also contribute to acne, contribute to aging, and then the dehydrating effect of alcohol as well.
Very, very good point. You know, caffeine and alcohol have a diuretic effect, and being dehydrated is bad for your skin, period.
And on that note, with fluid, we haven't talked fluid and hydration. How much do you see of someone's a big water drinker versus not? Do you see it in their skin?
It's, it's hard to spot that.
I think it's really hard to spot.
I really don't think, but just remind patients that if they wait until they're thirsty to drink water, they're already dehydrated.
Right, it's too late.
So you do have to be proactive with your water intake. And I'm a big fan of some lemon juice in your water.
Well, I find that people tend to drink more if it has a flavor. And now there's so many natural ways that we can flavor it. So just to clarify, when we hear that we know we need to drink more water, for our listeners, it isn't just water. It's pretty much any type of fluid is going to hydrate our body, any type of fluid that doesn't contain alcohol. So we used to actually think caffeinated beverages were completely dehydrating, but as long as you have a liquid in it, like a coffee or a tea, there's enough liquid in that caffeinated beverage that it actually still counts towards our fluid intake. So if you were to just take caffeine pills or do shots of the caffeinated energy drink, something like that, then it is definitely going to be dehydrating. But if you're having a coffee or a tea, actually that fluid does still count as fluid to hydrate us. Obviously, we don't want to overdo it on caffeine for a whole bunch of other reasons. But if you are doing something like an iced coffee, that can count towards your fluid intake. So when you look at how much do we need, the easiest way I look at it is take your body weight, divide it by 2, and that's how many ounces we need as that baseline. So if someone's 150 pounds, that means we need at least 75 ounces of fluid in a typical day. Now, if you sweat a lot, if you exercise a lot, step on the scale before and after exercise, and an additional 16 ounces for every pound of sweat lost. So if you're doing a boot camp, a spin class, going out for a jog, just see how much sweat are you losing, because that's even that much more that we're depleted kind of in the whole hydration wise. So, everything that we're taking in that's fluid, though, counts towards our fluid intake. So if it's a smoothie, if it's an iced coffee, if it's a soup. So it can be overwhelming to think if it's that much water a day, but it's just total fluids, not including alcohol. And of course, making sure you keep sugars, either no sugar in these fluids, or at least keep it to a minimum. And what about a very low-fat diet and aging and wrinkles? I feel like there's people that I know who their entire life through from the 1980s on, they were like fat-free everything.
It's a bad idea.
And I
Very
feel like
bad.
they have that crepey skin, but then I'm like, is that just in my head or is it okay?
So this should get into the discussion of the good fats versus the bad
Yes.
fats, if you will. So something like an avocado is very good for your skin. Olive oil is very good for your skin. But I know a guy who calls himself an anti-aging specialist. And he's bought into 100% this extremely low caloric diet because there have been studies in rats that have shown that if you basically write it about starvation, that you'll live longer. And my response to that is, I wouldn't want to live longer.
Yeah,
Okay?
they call it CR.
If I can't
caloric
eat,
restriction.
but I'm mindful with how I eat. And I choose the things that are better for me. I choose fish a lot. I choose vegetables over starches. I limit my dessert intake. All of those things. It's a gigantic global, every day you need to think about it. You don't have to obsess about it. First of all, eating should be a joyful thing. But it shouldn't be your only source of joy, okay? And it shouldn't be how you validate your existence. That's when you get into trouble.
And that's one of the things that I'm always working with clients on, and just kind of it's negotiating. It's what's really worth it. So the same old, just ordinary pasta, not worth it. My husband has started making homemade pasta. That's worth it. Fortunately
Yes,
for
it is.
everyone involved, he only makes it every couple of months. Otherwise, it would really be a problem if we had it because it's delicious. But I think that the low fat, the very, very low fat, I think is kind of making its way out for a lot of, because especially with new diets like keto and low carb and stuff, fats are making their way in. But I think it's still really important for people to hear that extreme low fat is not good for a number of reasons, including the aging of our skin.
Well, remember also, and you're the nutritionist, so tell me if this is correct, but my perception is that the low-fat diet fails to satisfy a person.
Oh, 100%.
And they end up by actually eating more calories, and those calories are usually carbs, and so they have more of a problem.
100%. And people have a fear. The people who are on that lower fat or very low fat diet have a fear of adding fats in. And so a lot of times, we have to be very gentle with that. We have to kind of trust me. I promise it's going to be okay, but let's clear out, because a lot of times they may have 2, 3, or 4 sources of starchy carbs at a meal or a snack, or their snack is an apple and some Triscuits or something. Well, let's have one or the other, and let's put some almond butter or peanut butter with it, or let's, dial back on your starches and add in some healthy fats in here. So I think it's, adding in those plant-based fats.
And zucchini pasta, quote,
Yes.
is fabulous.
Love. There's so many pasta alternatives. They don't measure up to Brad's homemade pasta.
No.
However, okay, so we've established that we do need fats in our diet for a whole bunch of reasons, including to benefit our skin. And of course, plant-based fats are always a good idea.
And we didn't talk about the omega-3 supplementation, and we really need to.
And that's super important. That dovetails into the fats.
Yeah, because
The good fats.
The good fats. And for sure, there is very strong data that actually I'm aware of because I have so many colleagues in ophthalmology. But there is an absolute link between a low omega-3 level in your bloodstream and chronic inflammation that is absolutely associated with dry eye. And almost all of the ophthalmologists recommend the omega-3 supplementation. But remember, it's the triglyceride form that is better absorbed. You don't want the ethyl ester form of the omega-3s. So you really want to be mindful and talk to your doctor about a source that is bioavailable, will not cause gastrointestinal upset. The ethyl esters are notorious for causing that. But I absolutely feel that omega-3 supplementation for people who have low omega indexes, that would be defined as definitely less than 5 or 6. If somebody's got like a 3 or a 4 and they've got rosacea, if I can get their omega index up to 8, they'll often have to be able to discontinue their oral medication for rosacea and sometimes even their topical medication.
So how does somebody get their omega levels checked?
Well, there is a test. It's called the omega-3. It's a finger stick. And it's not covered by most insurance, but the omega index test costs, it's like $35 out of pocket.
Where does somebody go for that?
Well, I do it in my office because I know about it, but there's omega tests that the doctor can get, and we do it, and then we send it off to them, and they give us a level back, and it gives us a breakdown. What's nice about doing the test is you have a quantitative analysis. And so you can then put someone on the supplementation and then follow it up 3 months, 6 months later and see the relative improvement in the omega index level. And is that reflected in a clinical improvement in their skin condition? So, as a scientist, I like to be able to have data that is relevant to the clinical facts and not just anecdotally. So if I have a patient and I just arbitrarily say, well, why don't you get on an omega-3 supplement? And they come back in 3 months and they're better. Well, are they better because of that? Or are they better because I've got them on a good skincare program and they're using the sunscreens and, whatever it is. So it's nice to be able to have something objective.
And when we're looking at the omega-3 supplementation for skin and for eye health, as you mentioned, it's full body inflammation though. If we have somebody with rheumatoid arthritis or any type of inflammatory issues.
Yeah, joint symptoms. I've had people tell me that their backaches get better. That their eyes feel better, their eyes are less itchy and irritated. So it's a global assessment of the patient, asking questions. Like I'm sure Julie does this. Every rosacea patient, you ask them, do you have ocular symptoms?
Absolutely. And it normally feels like sand in their eye. And that's how they will say.
And they're not even making the connection.
They have no idea.
That it's with their skin and their rosacea. Mm-hmm. My sister has rosacea, and I can't wait to share this information with her.
Well, same thing with psoriasis. People don't realize that their joint stiffness and their morning stiffness is because they have psoriatic arthritis or the early stages of psoriatic arthritis. They think, oh, well, I'm 45, so I'm stiff. I'm like, no, you're not supposed to be stiff at 45. That's not the way that works. So it's really their inflammatory disease that's causing it.
I think that from a vanity perspective, if someone has the desire to lose weight, or even it's harder for people to make a change when they're looking at such long term, if they're looking at cardiovascular disease or, the preventative measures they could take for diabetes or hypertension, it's hard for that to be your reality right now when you're looking at how was my diet going to prevent these things down the road. But when you're making this change right now to look better, I think that can be the motivation for a lot of the nutritional change that people can really benefit from, that maybe that just the weight or long-term disease is not enough of a motivator.
I tend to, a lot of times, talk about weight issues with my patients. And sometimes it's an aesthetic patient who's coming to me for cool sculpting or Kybella injections. And if they are obviously overweight, I usually will ask them, what is their height and what is their weight, their current weight? And I'm pretty good at calculating things in my brain. And so I will often look at them and I said, so ideally, you probably want to weigh, so let's say they weigh 210 pounds and they've told me their height. And I go, so ideally, what do you think? You would like to weigh about maybe 150? And they would go, oh yeah, that's where I would like to be. I said, well, are you working on trying to lose this weight? And they'll often go, well, kind of, sort of, and all this other stuff. I said, well, how about this? Rather than thinking I need to lose 60 pounds, why don't you think I want to lose 5? Why don't you just think I want to lose 5 pounds in the next month? Because thinking about 60 pounds is overwhelming and frightening, and it'll freeze you because you go, well, I just can't do that. And the problem is if you don't do anything when you're 60 pounds overweight, before you know it, you're going to be 75 pounds overweight. Because at one time, that person who's 60 pounds overweight was only 20 pounds overweight, and they didn't do anything about it. So by taking it, and like a friend of mine once said, how do you eat an elephant? And the answer is one bite at a time. And so we need to think of that in reverse and tell people, well, why don't you try to lose 5 pounds in the next month? And guess what? When they do lose that 5 pounds, they kind of go, okay, I'm going to try to lose 5 pounds next month. And they get the needle going in the better direction rather than losing ground. Because obesity for us, and I'm sure Julie will agree, my psoriasis patients are almost always overweight. And yes, there's a profound association with heart disease to the point where I think it's really scary for these younger people who have psoriasis and their risk of dying before they're 60 with a massive coronary. And so we really need to be helping our patients find the tools, because it's not just about the skin often, it's about your global health.
Okay. And I was just thinking, just to your point, so, you think about it, and I think it is very difficult for somebody to make a dietary decision when they're 35 for a disease that they might get when they're 60. I think that is hard to do. But when we're talking about our young psoriatics and our young hidradenitis suppurativas, these people are generally young, at least when they're diagnosed with it. And we know that psoriasis, for instance, is a multi-system disease. We've known for a long time that it involves skin and involves joints. But the last 5-10 years have really shown us how much cardiovascular influence that this systemic high level of inflammation has. And that by changing the diet and by going with what we call an anti-inflammatory diet, which would be things like low glycemic foods, and that's not just sugars, of course, it's also your white starches, your breads, your rice, your potatoes, all that. All those things contribute to inflammation and contribute not just to the disease that they might get in 50 years, but to the current skin disease that they're itching and scaling and miserable from right now.
And what I learned from you too is that psoriasis is so systemic. I've always thought of psoriasis as kind of a scaliness on the skin, and that's it.
No. We've known, since I was in residency, so 20 years or before, that is associated with the joints. But it's only more recently that we know how systemic it is. I mean, I often try to explain to patients that it's often like, because everybody's heard of lupus. And it's like lupus that can affect multiple parts of your body and multiple organs in your body. So psoriasis affects your skin, it affects your joints, it affects your heart. It can lead to increased diabetes. Obviously, obesity, smoking, both of those things, lifestyle choices do play into the severity of the disease.
What does the psoriasis look like? So if someone on their skin, so if someone's hearing this and they're like, wait a second, I've got joint pain, I've got some other things. I've got something on,
Right.
What does it look like on their skin?
So classically, psoriasis is a red, scaly plaque. And by plaque, I mean you normally can feel it over the skin, but not always. And it does have some classic areas. So psoriasis loves high friction points. It loves the scalp. It loves the elbows, the knees. Those are very common. Now, some people can have psoriasis everywhere, but those are very common areas to have psoriasis.
And obesity is a contributing factor.
Absolutely. It's a contributing factor to psoriasis and to the severity of psoriasis.
And the inflammatory diets. So this high glycemic load is going to be a contributing factor.
Absolutely. Well, we talk a lot about just having like sort of an anti-inflammatory diet. So you want to have a diet that's going to be high in either lean meats or fishes, high in fruits and vegetables.
And low in sugars.
Low, obviously, in all processed food and refined sugar.
And I think that's something that people don't realize so much too, that not only are those foods are inflammatory, so not only are they calorie dense and they're not good for your waistline, but the white rice, white potatoes, white pasta, sugars are also very pro-inflammatory. And then when we also look, going back to the patients you have who are suffering from depression from a lot of their skin conditions, these high glycemic diets also have a higher incidence of depression because we're also putting ourselves on this energy roller coaster, the sugar and mood roller coaster.
Right.
And our skin is such a direct reflection of our total whole body health. And so often it's our skin that's giving us those first signs, that first indication of other underlying health issues, and in some cases, pretty significant health issues.
And the other thing that, I'm sure you agree, another thing that brings people in to see me that's that their weight is sometimes relevant is I see women, they'll come in and they've got acne and they have hirsutism, and they're coming to see me because they want their acne better, but they want to get rid of their facial hair. And they walk in the room and I know that they have glucose intolerance, metabolic syndrome, pre-diabetes, and probably polycystic ovarian syndrome. And I'm amazed at the number of women I will ask them, and their OB-GYNs have never run a blood test for free testosterone and DHEAS. Right. And I probably diagnose as much, if not more, polycystic ovarian syndrome because I do acne and laser hair. And I'm going, well, and I'll tell them, I'm not going to be able to get as good of a result of overriding the androgenetic effects. We've got to get that under control. And then guess what? That laser hair is going to work really well. So I, as a dermatologist, I'm running hemoglobin A1Cs and free and total testosterones and DHEAS. I even diagnosed one time a woman who had unbelievably adrenal carcinoma. And she presented to me, her only symptom was the worst case of acne I'd ever seen in my life. And I went, this is not a normal type of acne. And when I ran the tests, it wasn't, if you've got polycystic ovarian syndrome, maybe your DHEAS is, 700. Her DHEAS, which is the male hormone that's produced by the adrenal gland, was over 5,000. So we knew that there was some sort of tumor on her adrenal gland pumping out all of these androgens that were causing her acne.
Really driving her acne.
Yeah. But unfortunately for her, it was cancerous. So, it's the skin is such a mirror.
Window into the body.
It is a complete window. You need, and this is why it's so important to see a board certified dermatologist, because other people who are dabbling in dermatology, they don't know what they don't know, quite frankly.
Rosacea is a very common complaint that people come in for. And normally you're going to have these red bumps that look like pimples on your face. And sometimes you just have sort of a baseline redness or a flushing that gets worse with certain things. Those things can be sun exposure. Those things can be dietary. A lot of times we tell patients about hot foods, spicy foods, alcoholic beverages, caffeine, all those can be what we call triggers for rosacea. Now, not everyone is going to have all of those triggers, but some people are going to have some of them. And it's important that we counsel our patients and that I counsel my patients on that. Now, like acne and some of the other diseases we've talked about, rosacea can be associated with other things. And we talked about this a little bit earlier. Eye findings are super common in rosacea. There's actually a type of rosacea called ocular rosacea, but it's often goes hand in hand with skin rosacea.
And so what would be the correlation that someone might notice about themselves that connects the eye issues with their rosacea? Is it dry eye, itchy eye?
It feels like you have sand in your eye. That's what I usually explain to my patients. Do you ever feel like you have sand in your eye? And they'll be like, yeah, that happens. Because you can have dry eyes from lots of things, lots of different conditions, and you can have dry eyes just by themselves. But it's really more of this irritated, feels like something's in your eye type of feeling.
And you have rosacea.
And the redness or the pimples on your cheeks.
And something like the checking for your omega levels or supplementing with omega-3s can help with this inflammation that can help with both of these.
Absolutely.
So let's shift gears and let's talk skin cancer. So I know whenever there's a lot of research that shows diet, I think it's so vague. A diet rich in vegetables and fruits is linked to a lower risk of cancer. It's so vague for people. And I think that that's a hard thing to motivate someone to put that into action. But how much do you see, and what does the data say as far as a diet rich in these antioxidant, filled vegetables and fruits as it relates to skin cancer specifically?
So, I will tell you, I think that the literature on the diet specifically with regard to skin cancer is not great. I mean, it's all over the place.
And there's so many other variables.
There are so many variables. I mean, just like we talked about before with just overall sun protection and the antioxidants that help provide and help to, clean up some of those free radicals that are caused from the sun. It's super important. Obviously, sunscreen every day is important, and it's important to remember to reapply it as well. But as far as from just an oral perspective, I mean, I recommend anybody that has had more than one or certainly several non-melanoma skin cancers to take niacinamide. It's very important that they take niacinamide and not niacin. Niacin, of course, will result in flushing. Niacinamide, and if you purchase it, you can often get it to say no flushing, or the brand, it'll say it right on there. And that will actually decrease the risk of non-melanoma skin cancer. Squamous cell carcinoma is more than basal cell carcinomas. But
so if someone is going to take niacinamide, would that be it's as a preventative measure for skin cancer?
Yes, that's
correct. And how much do you recommend that they take, and what are kind of the details on that?
500 milligrams twice a day. And I haven't had anybody have any problems with it at all.
So if someone is just kind of hasn't had any issues with it, but maybe they have had a lot of sun exposure in their life and they're looking at it, what is kind of every little bit I can do?
It's like chicken soup. It can't hurt,
it
might
hurt
help.
you.
Good.
And as we know, I mean, niacinamide is not just preventative for skin cancer, but it's also anti-inflammatory.
Yeah, and
So
there's
we
some
use
data
that.
with niacinamide with rosacea, and
Yes.
and there's another Heliocare called Heliocare Advanced, which has the recommended dosage of the niacinamide plus the polypodium and some other anti-aging. So it's kind of like anti-aging with an emphasis on skin cancers too. But I can honestly say, as much as I will talk about nutrition and diet for my maybe acne, rosacea, psoriasis, aging patients, I don't think I've ever talked to a skin cancer patient about a diet I recommended.
I haven't either. I would agree.
Okay.
But I do talk about niacinamide, and I do recommend niacinamide.
Absolutely.
And what about anything topical or oral antioxidants that you would that someone could take for this?
For skin cancer, the one that has the most data are these DNA repair enzymes that have been found. There's I'll give a shout out to one particular company that came from Spain that did a very intriguing study. They took 50 people with active actinic keratosis, which is sort of the precursor to squamous cell carcinoma. They treated all 50 identically with something called photodynamic therapy, which is they treat the whole face and it kind of peels. It's like getting a type of a chemical peel. And they treated all of them. Then they took 25 of the 50 and they had them use an SPF 50 zinc-based sunscreen every day. The other 25 got the same SPF 50 zinc-based sunscreen, but the additional ingredient of something called DNA repair-some, which is this this enzyme that would repair the damaged DNA. They followed them
topically.
Yes. So this was topical. Yes. So they followed these patients prospectively. And any doctor will tell you that the best studies are prospective rather than retrospective. There was a statistically significant fewer incidents of new actinic keratoses in the group that had this enzyme with the sunscreen than the sunscreen alone.
That is very interesting.
Yeah. So I was very impressed with that study. And if I have a patient that I'm treating for skin cancers, I recommend two things. I recommend this Isden, and it's called Erifetona actinica. Of course, why didn't they ask me what they should call it? I would have given them a much better name. Okay.
And that has that DNA enzyme in it?
And it has that enzyme repair in it. And the second thing I put them on is the Heliocare Advanced. And I go, look, if you want to do everything you can do, these are the two things you need to start doing now.
Because the Heliocare Advance has
the niacinamide.
The niacinamide, the 500 milligrams, or the dosage that would be recommended for skin cancer prevention. Also, the ingredients in the Heliocare that are sun protective.
Yes.
And then topically, you would be doing the Isden, let's say the name again.
Erifetona actinica.
Okay. And that is the DNA enzyme repair.
Plus an SPF 50 zinc. And I'm sure Julie will agree, but she's free to argue with me. I think that the mineral-based physical sunscreens are superior to the chemical ones by nature of how they work, because the chemical sunscreens work by absorbing the ultraviolet light and deactivating. As soon as that happens, that sunscreen's out of commission because the chemical reaction has occurred. Whereas the zinc is a physical block, which I think gives better protection.
I absolutely agree. And I, honestly, although I recommend sunscreens and I use sunscreens and certainly recommend them to all my patients. Whenever anybody asks me what the best sunscreen is, I'm always sun avoidance or sun protective clothing, hats, buffs, anything that you can do to really keep your skin out of the sun.
Yeah, don't rely on sunscreens alone. I call it avoiding gratuitous sun exposure. There is, you've got to be out in the sun if you're fishing, if you are snorkeling, but when you're
driving to work.
Right. You don't need it when you're driving to work. You also don't need it on the beach while you're reading your book. You need to be under the umbrella and be aware you're going to get reflective light from the sand. So you still need to use your sunscreen. So there's no free lunch here.
Exactly. So thanks so much, y'all, for spending your time with us today. And just one final question. I know that both of you each do so much. Your days are filled with just so much. But if you can sum it up for us, what is the most rewarding part that you feel that being a dermatologist means for you? Why is it that you do what you do?
I take care of a lot of people with psoriasis, a lot of people with hidradenitis suppurativa, a lot of people with really horrible skin diseases that impacts them, it impacts their families, it impacts their work, it impacts their entire lives. And that's what I enjoy. I enjoy making them better.
I would say that the most rewarding thing about my practice is when I give my patients confidence and they feel better about how they look and how they're presenting themselves to the world. Obviously, it is also very rewarding when I have seen a patient with something on their skin and I've alerted them to the significance of it and they've sought additional care and another diagnosis such as hepatitis or polycystic ovarian syndrome or some sort of cancer was diagnosed. Obviously, when you potentially save a patient's life by diagnosing a melanoma early or preventing a significant disability when you spot a basal cell on their face, when it's only been there for a few months rather than several years, all of those things. So for me, what makes me happy is when my patient's life is better because they came to see me.
You guys are both so passionate about what you do, and it's why you're so fantastic at what you do. So thank you so much again for spending your time with us. So to our listeners, I hope that you've enjoyed the Skin and Nutrition podcast as much as I have and that you've learned as much as I have. We covered a lot, so we'll have the links to specific products in the show notes. And to summarize, kind of in a nutshell, of course, sunscreen, a mineral-based one preferably. Dr. Lupo had mentioned Isden's Erifotona actinica. We may not be saying that right, but we'll have the link to it in the show notes. It's a mineral-based sunscreen that has 50 SPF, and it's also been shown to help with that DNA repair. So that's what she had mentioned there. In addition to sunscreen, the supplements, niacinamide or B3, which is also in that HelioCare Advanced. You can find it on Amazon. And 1,000 milligrams of vitamin C once to twice daily and 400 units of vitamin E daily. And when it comes to diet, dialing back on sugar and white carbs, it is the biggest single change we can make to boost the health and the appearance of our skin. And finally, I hope that you take these tools and this knowledge and start to implement these strategies as part of your daily lives. It doesn't have to all happen at once, but every little bit truly does add up, and the rewards will be more than worth it when you're not only healthier, but you feel better too, and your skin clearly shows it as well. I'm Molly Kimball, and you've been listening to Fueled Wellness and Nutrition, the podcast. You can follow Molly Kimball RD on Instagram, Facebook, and Twitter. And if you haven't yet, subscribe, rate, and review this podcast. Join us next week for another dose of Fueled Wellness and Nutrition. Thanks for listening, and stay focused on living your strongest, healthiest life possible.